With the arrival of the new therapies in spinal muscular atrophy, the patients has changed the trajectories of the disease. So all the things that we have seen during years in the natural history now is totally different. We transform the phenotypes of the patients in a novel mix of motor function, respiratory, nutritional, and orthopedic features. For example, a patient that was not able just to sit now is able to sit, or a patient that was not able just to stand now is able to stand. And besides that, there are a lot of different features that come in, particularly in the severe cases with SMA. In these sessions, we have discussed particularly what's happened with the new phenotypes in adults. And adults have a more chronic evolution of the disease, so that means that the different phenotypes are more involved in the neuromuscular system. But for example, in severe cases, we have a more involvement perhaps of other systems and perhaps a different way in which the severity of the disease is just transforming these patients in a better outcome. At the end, the results is that we are facing new challenge, and we are seeing patients that were not able to live more than 2 years, and now they are surviving for several years and are becoming even adolescents or even adults. So that means that with the treatment, perhaps we are going to see things that we never saw before. So that means that we have to be alert and following this patient in different systems, not only the neuromuscular system, but also other issues like, for example, the possibility of developing language, what is going on with the metabolic issues, what is going on with the function of other different organs like heart, like pancreas, like, for example, bone health. So we are doing a wide spectrum of alerts for trying to get into the real novel definition of the phenotypes.
I think it's very important to remember that more than 700 children are born with SMA every year in Europe. So it means like 20 children a day are diagnosed with this very severe disorder. In most countries, we can now get children on treatment very soon. The big problem with SMA and many progressive neuromuscular disorders is that once the disease starts, once the disease manifests itself, you cannot really cure the symptoms. You cannot get rid of the symptoms, and the child has to live with lifelong disability. In SMA, half of the children would have a very severe course of the disease, with symptoms appearing before 6 months. So these children, when treated after diagnosis, symptomatic diagnosis, they will possibly learn to sit, maybe stand supported, walk a few steps, but they will spend their life with needing a lot of support. Newborn screening is a tool that gives us, that's I would say magic. We detect these children before symptoms appear, and now we have 3 treatments available that are able to stop the disease from manifesting itself ever. So these children, these 700 children a year, will live like healthy children. They will live full lives. So this is, to me, as a parent of a child with SMA, it's a no-brainer. Let's save those children. Let's save them from, let's save their lives.